Recurrent IVF failure is a severe problem for couples undergoing IVF, and approximately 10% of couples who underwent an IVF cycle might have this problem: recurrent implantation failure or recurrent IVF failure. Recurrent implantation failure is described as having no pregnancy after the transfer of 4 embryos. These embryos may be fresh or frozen, but a failure of pregnancy after the transfer of 4 embryos, couples can be classified as having recurrent implantation failure. Now, let's discuss about the causes of this problem. Let's talk about lifestyle and environmental factors that might be effective on having recurrent implantation failure, such as obesity, alcohol consumption, or cigarette smoking may be a factor in having no success through IVF. So, in order to increase success rate through IVF, you better stop smoking, don't use alcohol, use maybe detrimental, and try to have a normal body weight. If you do so, you will increase your chances of getting pregnancy significantly. Some medical problems might affect your fertility potential, and if you have some encounter having recurrent implantation failures, what are the diseases or abnormalities which might affect implantation potential? These are polycystic ovaries, diabetes, thyroid dysfunction, and immunologic disorders. In order to diagnose and to treat the disorders prior to IVF procedure, we screen thyroid hormones and perform vaginal sonogram to rule out these disorders. So don't forget, some medical problems, medical diseases might affect your fertility potential and cause recurrent implantation failures. Therefore, they need to be fixed, evaluated, and treated beforehand. Uterine factors such as adhesions in the uterus and abnormalities might affect fertility potential and might be the cause of recurrent implantation failures. Hysterosalpingogram or hysteroscopy are the most commonly used tests to evaluate the uterine cavity. So if you have recurrent implantation failure, your uterus needs to be evaluated carefully, and if there is any abnormalities found, that needs to be corrected prior to IVF procedure. Chromosomal abnormalities in couples might contribute to recurrent implantation failure. Therefore, women and men should be screened to rule out any chromosomal abnormality before the IVF procedure. If there is any PGT, pre-implantation genetic diagnosis, can be carried out to rule out the chromosomal abnormality and to select the chromosomally best embryos available. So don't forget, chromosomal abnormalities may be a causative factor in having recurrent implantation failure. In some cases, immunological factors might be the cause of recurrent implantation failures. Even though it's very difficult to identify the exact reason or definitive reason of recurrent implantation failure immunologically, we do have some tests to rule out these problems in women. However, there's still debate over the issue of immunological factors recurrent implantation failure. The diagnosis and/or the treatment are still debatable. There are still many many studies looking at this problem in terms of evaluation and the treatment of immunological disorders. Recurrent implantation failure is one of the most debatable parts of reproductive endocrinology. Many tests are still being developed to evaluate and treat the disorder. We do know much about the egg and the embryo, but little know about the endometrium, where embryos stick to and embed to. There are some tests developed to assess endometrial receptivity, but still ongoing debate of the efficacy of these tests. So, recurrent implantation failure is still a problematic issue in the field of reproductive medicine, and if you have this problem, please don't quit to have a baby, don't postpone your dreams of having a baby, and there are still something to do in couples having this problem.